All right, hello and welcome to the Social Party of Canada's daily release. Today's topic is universal basic healthcare, as mentioned yesterday during our talks about universal basic income. We would seek to create a system of universal basic healthcare for all Canadians. This would seek to replace current provincial health plans. And something forgot to add during our discussions on UBI yesterday is that the UBI, UBH, and UE policies will all be designed as any changes made to them by future parties require a referendum vote by Canadian citizens. This will allow these single programs to not be targeted for elimination or drastic changes, cuts, or decreases by any future political party of Canada without the say of the Canadian people. That being said, we will now discuss universal basic healthcare. Right now, our healthcare system is not quite perfect. We get free things such as doctor hospital visits, surgeries, and things like that, while being required to pay for other services such as dental, eye care, and prescription drugs. This is a form of social injustice that we seek to correct with the creation of universal basic healthcare. The universal basic healthcare system would create an umbrella of healthcare services that are free to all Canadian citizens. This would still include hospital visits, stays, doctor's visits, but would also seek to add dentistry, optometry, and prescription drugs to the list of covered services under the Healthcare Act. We would also like to add services such as chiropractics, physiotherapy, and massage therapy, contingent on doctor's recommendation before UBI would cover these services. This would essentially replace most, if not all, current private insurance programs that cover things like dentistry and prescription drugs. Keeping into account that we cannot kill an entire economic sector, we would seek to make a shift in the responsibilities of private healthcare insurance plans, such as covering additional services not covered by universal basic healthcare. Universal basic healthcare would cover generic prescription drugs. This will allow for private health plans to cover the price difference, of the more expensive brand name medications, as well as more expensive eyeglasses and or other eyewear not fully covered by universal basic healthcare. Universal basic healthcare will be set to cover certain amounts in certain industries. This mostly regarded around prescription drugs, private medical access such as private rooms in a hospital, and so forth. These services would shift to private insurance companies' responsibilities for covering, while allowing the industry to still exist in the Canadian economy under a different role. Universal basic health care would provide a standard of good health to all Canadians. Our current healthcare system overlooks some of the most important parts of our health, our dental health and our vision. Dental health and good dental condition are important. Someone with poor dental health may have a harder time seeking and finding employment. And it is for this reason that covering these services is essential for our betterment as a society. Again, much like UBI, UBH will depend on the reallocation of existing funds that currently fund provincial health programs and other health initiatives. Redistribution of these funds may not be enough to fully cover the universal basic health care plan. It is for this reason we would implement taxation for universal basic health care. This would be contingent on income amounts, much like UBI, where those on base universal basic income and making under $15,000 a year additional income will not be required to pay for universal basic health care. Those making above $15,000 a year will be required to pay a small amount monthly towards universal basic health care. This amount may reflect numbers as small as $10 a month. Depending on your level of income, these amounts paid will increase. Once we reach the point when a person is no longer on universal basic income, we see a drastic increase in the payment amounts to universal basic health care. A person making over $85,000 a year take home may be required to pay as much as $50 a month to support the universal basic health care program, whereas high earning Canadians making upwards of hundreds of thousands of dollars a year may be required to pay significantly large amounts to benefit from the universal basic health care program. As well, Canadians possessing excessive wealth in excess of $1 million will not qualify for programs provided under universal basic health care, including dentistry and prescription drugs. We would ask that the Canadians who can afford to pay for these services pay for them out of pocket so as not to overwhelm the system for those who need it. The system of universal basic health care would be a protected act requiring a referendum vote to remove. We would also seek to bring into the umbrella of health care all mental health services, whether they currently be private or government run. We would seek to cover any and all mental health services, as well as drastically increasing funding towards mental health awareness. Mental health has become a driving issue of our generation. The mental health of people has deteriorated due to the conditions in which they are forced to work, their living environment, and an overall result of the advancements of technology. For this reason, mental health support is a very important area for us. We would seek to greatly increase access to mental health and mental health counseling availability, as well as removing restrictions to access to these programs, making them available for every Canadian, regardless of income or stature. Part of this would see us training new and more psychologists, psychiatrists, and counselors. This would fall as part of the Universal Education Act, allowing Canadians to return to post-secondary education for free when the costs are fully covered by the government. This will allow us to have more well-trained professionals in the medical industry as well as in various other industries, advancing the overall effectiveness of the system in which we are creating. It is important that we create a system of equal opportunity and equal access, benefiting most those who need it most, and asking that those who can afford it help pay for the costs to allow everyone else to benefit equally from what our society has to offer. Tomorrow's topic will be universal education and free post-secondary education. Thank you for tuning in today, and talk to you tomorrow.